Tell us a little bit more about your company with your company's name and the problem you're solving.
Sure. So the company is Danacardia, and we're based in Boston, although we have offices and people in California and in India as well. And then the problem we're solving is that we're developing a continuous non-invasive blood pressure and hemodynamic monitor, so kind of this wrist wearable device. And we know that blood pressure varies throughout the day, week, month, right? So when you get your blood pressure measured at the doctor's office, sometimes it'll come up as high, and they say, "Hey, why don't we do this again later when you're a little bit more relaxed?" And you have to do it. You have to sit quietly, and they measure it again, and your blood pressure drops. You can do this at home with one of the machines, but the reality is that, which number is correct, right? We know that your blood pressure is changing. So imagine that over the day, over the week, a month, over a year, we use that one number as an indication of your health. So we know that about 1.4 billion people worldwide are hypertensive. Wow. And I think nearly half of the US adult population is hypertensive. And about 30% of them are misdiagnosed, which means they're not being treated. And it's the number one cause of stroke and heart attack. The other side of blood pressure is this hypotension, which is low blood pressure, which not everyone knows about unless you are unfortunately in the hospital and have to have surgery. But hypotension is when your blood pressure drops to a very low level. And it's a big issue in hospitals and in critical care. So I'd say in the US, there's about 30 million major non-cardiac surgeries where around 70% of patients experience extensive periods of intraoperative hypotension. And in the ICU, it's also a big problem too. About 5 million patients actually require blood pressure monitoring. And many of those are at risk for acute kidney injuries and heart attacks. So there's a lot of stuff that's going on. And we know that the current way of measuring, so that machine that we talked about before, has two major limitations. So we're talking about this cuff on your arm, the machine that you can get at the local drugstore or the one that's usually in the doctor's office. It's inaccuracy in measurements, and it's the inability to measure BP continuously, or blood pressure continuously. And that results in the gaps. And those gaps are the things that we're trying to address.
Describe your startup in a few sentences and how you're helping these people.
So we're a spinoff from MIT and Tufts Medical School. And that's where the technology was developed, and many of the founders, the CEO, Wong is one of them. The team developed an accurate cuffless continuous non-invasive blood pressure technology. And it doesn't require external calibration. And the way to think about it is if you put your finger on your pulse, what you feel is the force transmitted from the pressure wave in the blood vessel. Okay. So we've developed an optomechanical sensor that's orders of magnitude more sensitive than your fingertips. And then using video imagery and video image data, we've essentially created a force sensor array that converts force to pixels. So with that information, we reconstruct the pressure wave in the blood vessel and can, through some image-based markers, determine systolic and diastolic pressures directly. So just for everyone's, the systolic pressure is your top number that you often hear about, and diastolic is the lower number.
Why do you believe you're the right person to solve this problem?
Well, personally, I'm passionate about this space. I've spent over 30 years in product development, all of it in medical devices. And early in my career, I was involved in patient monitoring. I worked for GE Healthcare, where I was a system architect, and was involved in NIBP, non-invasive blood pressure development. There is some knowledge there that I can bring forward. I also have, again, worked in the industry for a long time and have a lot of experience with medical devices and companies, and understand some of the issues that come up and how to, overcome them. I have a decent network of people that I've run across throughout the years, so designers, engineers, usability experts, regulatory experts, and so on, that are really useful to develop a product. But really, I don't think it's that I'm the right person. I think it's that we have the right team. So the technology that we're developing takes a really fresh approach to blood pressure measurement, and I believe with the technology and talent and the motivation that we can make this work.